Blindness due to cataracts. Cataracts, a leading cause of vision loss in seniors. Cataracts are a common cause of blindness in older adults, significantly impairing quality of life by obstructing daily activities such as reading, driving, or recognizing familiar faces. According to the World Health Organization, WHO, cataracts account for approximately 51% of global blindness, impacting over 20 million people, predominantly those over 60. In Vietnam, millions of seniors grapple with this condition, making it a pressing public health issue. The condition clouds the eye's lens, leading to blurred vision and, if untreated, blindness. However, advancements in medical technology, particularly cataract surgery, offer hope, with a success rate exceeding 95%. Early awareness, timely intervention, and preventive measures can empower seniors to maintain clear vision and independence in their golden years. This comprehensive guide explores cataracts in depth, tailored for seniors and caregivers. It covers what cataracts are, why they are prevalent in older adults, their causes, symptoms, diagnostic methods, treatment options, and prevention strategies. The article includes scientific evidence, expert insights, historical and cultural context, a detailed 7-day plan for eye health, case studies, global perspectives, and community resources. Whether you're a senior experiencing vision changes or a caregiver seeking solutions, this guide provides actionable steps to protect vision, enhance well-being, and live vibrantly. Understanding cataracts. What are they? The lens of the eye, a transparent structure behind the pupil, focuses light onto the retina to produce clear images. Cataracts occur when this lens becomes cloudy, obstructing light and causing blurred or dim vision. This cloudiness results from the breakdown or clumping of proteins in the lens, reducing its transparency. In severe cases, cataracts can lead to complete vision loss, significantly affecting independence and quality of life. In older adults, cataracts are primarily age-related, known as senile cataracts, resulting from natural degenerative processes. However, other factors, such as trauma, medical conditions, or prolonged exposure to ultraviolet UV rays, can trigger earlier onset. A 2020 study in ophthalmology reported that 50% of individuals over 75 in developed and developing countries show cataract signs, with higher prevalence in sun-rich regions like Vietnam due to UV exposure. Globally, cataracts remain the leading cause of reversible blindness, emphasizing the importance of early detection and treatment. Cataracts are not contagious or cancerous, but are a structural disorder of the eye. While they cannot be reversed with medication or lifestyle alone, modern surgical techniques such as phacoemulsification allow for safe and effective restoration of vision. Understanding the condition's nature is the first step toward managing its impact. Types of cataracts. Cataracts are classified based on their location in the lens or underlying cause. Nuclear cataracts develop in the lens's central nucleus, typically due to aging. They cause blurred central vision and difficulty seeing in low light, common in seniors over 70. Cortical cataracts affect the lens's outer cortex, forming white, wedge-shaped opacities. Patients often experience glare or halos around lights, impacting night driving. Posterior subcapsular cataracts form on the lens's back surface, progressing rapidly and causing issues with reading or bright light exposure. These are common in patients with diabetes or those using corticosteroids. Congenital cataracts, present at birth, often due to genetic mutations or prenatal infections, though rare in seniors. Secondary cataracts result from factors like diabetes, prolonged corticosteroid use, or eye trauma, often seen in older adults with chronic conditions. Nuclear and cortical cataracts are the most prevalent in seniors, contributing to the majority of vision loss cases if untreated, according to a 2019 study in Journal of Gerontology. Why are cataracts so common in older adults? The high prevalence of cataracts in seniors stems from a combination of physiological, environmental, and lifestyle factors that accumulate over time. Below are the key contributors. 1. Natural aging process. As we age, the lens's proteins degrade, leading to clumping and cloudiness. A 2019 study in Journal of Gerontology found that over 80% of individuals over 80 exhibit some degree of cataract formation. The eye's reduced capacity to repair cellular damage exacerbates this process, making age-related cataracts nearly inevitable without intervention. 2. Ultraviolet, UV, radiation exposure. Prolonged exposure to UV rays from sunlight causes oxidative damage to the lens, accelerating protein breakdown. In tropical countries like Vietnam, where sunlight is intense, the risk is heightened. A 2021 study in Investigative Ophthalmology and Visual Science noted a 20% higher cataract incidence in tropical regions compared to temperate zones, underscoring the environmental impact. 3. Chronic health conditions. Chronic diseases common in seniors, such as diabetes and hypertension, increase cataract risk. Diabetes, affecting 25% of older adults in Vietnam, per the Ministry of Health, causes microvascular damage in the eye, leading to secondary cataracts. Hypertension can also impair blood flow to the lens, contributing to its degeneration. 4. Long-term medication use. Certain medications, particularly corticosteroids used for arthritis or autoimmune disorders, are linked to cataracts. A 2020 study in American Journal of Ophthalmology found that over 5 years of corticosteroid use, oral or injected, increases the risk of posterior subcapsular cataracts by 30%. Other drugs, like diuretics or antipsychotics, may also contribute. 5. Decline in antioxidant defenses. The aging body produces fewer antioxidants, such as glutathione, which protect the lens from oxidative stress. This decline accelerates protein damage, hastening cataract formation. Diets low in antioxidant-rich foods exacerbate this issue. 6. Eye trauma or prior surgeries. Seniors with a history of eye injuries or surgeries, e.g., for glaucoma or retinal issues, face higher risks due to structural changes in the lens. A 2018 study in ophthalmology clinics noted that post-traumatic cataracts are common in older adults who have experienced falls or accidents. 7. Lifestyle factors. Smoking and alcohol. Smoking and excessive alcohol consumption increase oxidative stress, damaging the lens. A 2018 study in British Journal of Ophthalmology reported that smokers have a 2-fold higher risk of cataracts compared to non-smokers. Heavy alcohol use similarly contributes to lens clouding. 8. Genetic predisposition. While less common, genetic factors can influence cataract risk. Seniors with a family history of early-onset cataracts may develop them sooner, per a 2020 study in Genetics in Medicine. These factors collectively make cataracts a significant concern for older adults, particularly in regions with high UV exposure and limited access to early screening. Awareness of these risks is crucial for prevention and timely intervention. Symptoms of cataracts. Cataract symptoms develop gradually, often mistaken for normal aging by seniors. Recognizing these signs early is vital for seeking timely care. Common symptoms include blurred or cloudy vision. Objects appear hazy, as if viewed through fog or a dirty window. For instance, Mrs. Mai, 72, from Hanoi, struggled to read newspapers despite wearing glasses. Difficulty seeing in low light. Vision worsens at night or in dim environments, complicating tasks like driving or navigating stairs in the evening. Glare sensitivity. Bright lights, such as car headlights or sunlight, cause discomfort or create halos, making outdoor activities challenging. Faded or yellowed colors. Colors lose vibrancy, appearing washed out or tinged with yellow-brown, affecting tasks like distinguishing clothing hues. Double vision or ghost images. Some seniors see doubled or distorted images, particularly with cortical cataracts, impacting reading or facial recognition. Frequent prescription changes. Rapid changes in eyeglass or contact lens prescriptions due to progressing cataracts. Impaired daily activities. Tasks like reading, sewing, cooking, or recognizing faces become difficult, reducing independence and confidence. A 2021 study in Journal of Cataract and Refractive Surgery found that 60% of seniors with cataracts report a diminished quality of life due to challenges with daily tasks. Symptoms may begin in one eye but often affect both, with varying severity. Early recognition and medical consultation can prevent progression to severe vision loss. Diagnosing cataracts. Accurate diagnosis of cataracts requires a thorough evaluation by an ophthalmologist, using a combination of clinical assessments and specialized tests. Diagnostic methods include medical history and symptom review. The doctor asks about symptoms like blurred vision, glare sensitivity, or night vision issues, as well as medical history, e.g., diabetes, corticosteroid use, eye trauma. Visual acuity test. Using an eye chart or images to measure vision clarity, often revealing deficits uncorrectable by standard glasses. Slit lamp examination. A slit lamp magnifies the eye, allowing detailed observation of lens cloudiness to determine the type and severity of cataracts. Dilated eye. Exam. Eye drops dilate the pupil, enabling the doctor to examine the retina and rule out other conditions like macular degeneration or diabetic retinopathy. Intraocular pressure test measures eye pressure to exclude glaucoma, a common co-occurring condition in seniors. Additional imaging. In complex cases, CT or MRI scans may be used to check for structural abnormalities in the eye or brain. The American Academy of Ophthalmology recommends eye exams every 1 to 2 years for adults over 60, even without symptoms, to detect cataracts early. In Vietnam, facilities like the Central Eye Hospital and Ho Chi Minh City Eye Hospital provide advanced diagnostic tools, ensuring accurate assessments. Treatment options for cataracts. Cataracts cannot be reversed with medication or lifestyle changes, but effective treatments can restore vision. Treatment depends on the cataract severity and the patient's overall health. 1. Non-surgical management, early stages. Updated glasses or magnifiers. In early cataracts, new prescriptions or magnifying tools can improve vision temporarily. Enhanced lighting, brighter lighting for reading or tasks, and anti-glare glasses to reduce light sensitivity. Regular monitoring. Ophthalmologists may recommend periodic checkups to track progression, delaying surgery until necessary. 2. Cataract surgery. Surgery is the definitive treatment for significant cataracts, boasting a 95% success rate, per a 2022 study in The Lancet. Common procedures include phacoemulsification, phaco, the most widely used method, employing ultrasound to break up the cloudy lens, which is then replaced with an artificial intraocular lens, IOL. The procedure lasts 15 to 30 minutes under local anesthesia, with same-day discharge. Extracapsular cataract extraction, ECCE. For advanced cataracts, the entire lens is removed and replaced with an IOL, typically requiring a larger incision. Intraocular lenses, IOLs. Options include monofocal, fixed focus, multifocal, near and far vision, or light-adjustable lenses customized to the patient's needs. In Vietnam, cataract surgery costs range from 5-20 million VND per eye, depending on the IOL type and facility. Leading hospitals like the Central Eye Hospital use state-of-the-art technology for optimal outcomes. 3. Post-surgery care use prescribed antibiotic and anti-inflammatory eye drops for 2 to 4 weeks. Avoid rubbing eyes, heavy lifting, or dust exposure during recovery, typically 4 to 6 weeks. Wear protective eyewear, e.g., sunglasses or eye shields, to prevent injury. Attend follow-up visits to monitor vision improvement and address complications. 4. Alternatives for non-surgical candidates. In rare cases where surgery is not feasible, e.g. though due to severe health issues, low-vision aids like magnifying glasses or specialized lighting can help maximize remaining vision. Occupational therapists can recommend adaptive tools for daily tasks. 5. Technological advancements in cataract treatment. Recent innovations have enhanced cataract surgery outcomes. Femtosecond laser-assisted surgery uses lasers for precise incisions, reducing recovery time, though less common in Vietnam due to cost. Advanced IOLs, toric lenses for astigmatism correction or multifocal lenses for reduced glasses dependency. Intraoperative imaging, real-time imaging during surgery improves IOL placement accuracy. These advancements, discussed in a 2023 article in Journal of Ophthalmic Research, have increased surgery safety and efficacy, particularly for seniors with complex eye conditions. Preventing cataracts. While age-related cataracts are difficult to prevent entirely, certain measures can slow progression and reduce risk. UV protection. Wear UV-blocking sunglasses or wide-brimmed hats outdoors. A 2021 study in ophthalmic research found that consistent UV protection reduces cataract risk by 15%. Antioxidant-rich diet. Consume foods high in vitamin C, oranges, bell peppers, vitamin E, sunflower seeds, almonds, and beta-carotene, pumpkin carrots. A 2019 study in nutrients showed that carotenoid-rich diets lower cataract risk by 20%. Chronic disease management. Control diabetes, hypertension, and cholesterol through medication, diet, and exercise to minimize eye damage. Smoking cessation and alcohol moderation. Quitting smoking and limiting alcohol reduces oxidative stress. Community smoking cessation programs can provide support. Regular eye exams. Seniors over 60 should have eye checkups every 1 to 2 years to detect cataracts early. Physical activity. Walking, yoga, or Tai Chi improves blood circulation, supporting eye health. A 2020 study in American Journal of Preventive Medicine linked regular exercise to a 10% reduction in cataract risk. Hydration and general health. Adequate hydration and a balanced diet support overall eye function, reducing the impact of aging on the lens. 7-day eye health plan for seniors. This senior-friendly 7-day plan integrates diet, eye exercises, physical activity, and lifestyle adjustments to support eye health, slow cataract progression, and enhance well-being. Each day includes detailed recommendations to make it practical and engaging. Monday morning. Start with a pumpkin smoothie. 100 green pumpkin, 1 banana, 200 ml almond milk, 10 green chia seeds, rich in beta-carotene. Perform a near-far focus exercise. Focus on a near object, e.g. a pen, for 10 seconds, then a far object, e.g. a tree, for 10 seconds, repeating 5 times to stimulate eye muscles. Afternoon. Lunch with a spinach salad, cherry tomatoes, grilled salmon, and olive oil drizzle. Omega-3 and antioxidants. Walk for 15 minutes in a park, wearing UV protective sunglasses and a hat to shield eyes. Reflect on how clear vision enhances the experience. Evening. Practice 5-minute mindfulness meditation to reduce stress, a cataract risk factor. Dinner with stir-fried chicken, bell peppers, and brown rice. Low glycemic index. Check home lighting, ensuring bright, non-glaring lights for reading or tasks. Tuesday morning. Oatmeal with blueberries and flax seeds, vitamin C and E. Blink rapidly for 20 seconds to keep eyes moist, repeating 3 times. This helps combat dry eyes, common in seniors. Afternoon, carrot pumpkin soup. 200 g pumpkin, 1 carrot, 500 ml low-sodium broth for lunch. Walk for 10 minutes with a wide-brimmed hat, noting any vision changes in a journal. Join a community walking group if possible to stay motivated. Evening, watch TV with adequate room lighting to avoid glare. Dinner with tofu, broccoli, and cashews, antioxidant rich. Review medications with a pharmacist to identify any that may affect vision. Wednesday morning, orange and spinach smoothie. 1 orange, 1 cup spinach, 200 ml unsweetened milk. Perform eye rotations. Move eyes in circles 5 times clockwise, then counterclockwise, to improve blood flow. Afternoon, quinoa salad with roasted pumpkin and walnuts for lunch. Attend a 10-minute chair yoga session at a community center or follow an online video, focusing on gentle stretches to enhance circulation. Wear non-slip shoes for safety. Evening, keep a vision symptom journal, noting issues like blur or glare. Dinner with baked cod, asparagus, and quinoa. Install brighter bulbs in high-traffic areas like hallways to reduce fall risks. Thursday morning, whole grain toast with avocado and pureed pumpkin, rich in vitamin E. Cover one eye and focus on a point for 10 seconds. Switch eyes. Repeat 5 times to strengthen eye muscles. Afternoon, lentil soup with carrots and turmeric, antioxidants, for lunch. Walk for 15 minutes with UV protective sunglasses, accompanied by a caregiver or friend for safety. Discuss any vision changes with them. Evening, relax with 5 minutes of soft music to reduce stress. Dinner with grilled chicken, sweet potato, and spinach. Check bathroom lighting, ensuring it's bright enough for safe navigation. Friday morning, apple and pumpkin porridge. 50-gram oats, 100-gram pumpkin, 1 apple. Perform eye exercise. Look up, down, left, right 10 times to boost circulation. Sip water to stay hydrated, aiding eye moisture. Afternoon, salmon salad with arugula and sunflower seeds for lunch. Join a local eye health support group, in person or online, to share experiences and learn coping strategies. Discuss cataract concerns with peers. Evening, dinner with stir-fried tofu, bell peppers, and quinoa. Practice deep breathing for 5 minutes to reduce stress. Ensure home is free of tripping hazards like loose rugs to support safe movement. Saturday morning, chia pudding with pumpkin and blueberries, antioxidant packed. Blink rapidly for 20 seconds, rest for 10 seconds, repeat 5 times to maintain eye moisture. Review the week's vision journal. Afternoon, roasted pumpkin salad with chickpeas and olive oil for lunch. Walk for 10 minutes with a family member wearing UV protective sunglasses. Engage in a light conversation to boost mood. Evening, dinner with grilled mackerel, kale, and brown rice. Practice 5-minute progressive muscle relaxation. Tense and release muscles from toes to head. Add a nightlight in the bedroom for safe nighttime navigation. Sunday morning, spinach, banana, and pumpkin smoothie. Perform near-far focus exercise 10 times to improve visual focus. Reflect on how diet and exercise have impacted energy levels. Afternoon, salmon salad with kale and flax seeds for lunch. Attend a community eye health workshop or watch an online seminar on cataract prevention. Take notes to share with a caregiver or doctor. Evening, dinner with stir-fried chicken, asparagus, and brown rice. Review the week's progress in the vision journal, noting improvements or concerns. Plan a follow-up eye exam if symptoms persist. Psychological and social impacts of cataracts. Cataracts affect more than just vision. They impact mental health and social engagement. A 2018 study in Journal of Psychosomatic Research found that 25% of seniors with cataracts experience depression or anxiety due to reduced independence, fear of falling, or social isolation. For example, difficulty recognizing faces or reading can lead to withdrawal from social activities, diminishing quality of life. Case study: Mr. Hung, 70, from Ho Chi Minh City, felt isolated when cataracts prevented him from reading to his grandchildren. After successful surgery and joining a community yoga class, he regained confidence, hosted family dinners, and reconnected with his community, highlighting the transformative impact of treatment. Engaging in social activities like support groups, healthy cooking classes, or low-impact exercise, e.g. Tai Chi, can mitigate these effects. These activities foster connection, reduce stress, and promote a sense of purpose, crucial for seniors' mental well-being. Global perspectives on cataracts. Cataract prevalence and management vary globally due to differences in healthcare access, environmental factors, and cultural attitudes. In developed countries like the United States, routine eye screenings and advanced surgical techniques result in early detection and high success rates, with over 3 million cataract surgeries performed annually, per the American Academy of Ophthalmology. In contrast, in low-resource settings like parts of Africa or rural Asia, limited access to eye care leads to higher blindness rates, with WHO estimating that 80% of cataract-related blindness in low-income countries is preventable with timely intervention. In Vietnam, urban centers like Hanoi and Ho Chi Minh City offer advanced eye care, but rural areas face challenges like cost and distance to facilities. Community outreach programs, such as mobile eye clinics, are addressing this gap, providing screenings and subsidized surgeries. A 2022 report by the Vietnam Ophthalmology Association noted that such initiatives have reduced cataract-related blindness by 15% in rural regions over the past decade. Cultural beliefs also influence management. In some Asian cultures, seniors may delay treatment due to misconceptions that vision loss is a natural part of aging. Education campaigns, like those by the Central Eye Hospital, aim to dispel these myths, encouraging early intervention. Historical and cultural context. Cataracts have been recognized for centuries, with early treatments dating back to ancient civilizations. In ancient Egypt, around 2000 BCE, healers used herbal poultices to treat cloudy vision, though with limited success. The first recorded cataract surgery, couching, was performed in India around 600 BCE, pushing the cloudy lens aside to restore partial vision, a risky procedure by modern standards. In traditional Chinese medicine, cataracts were linked to liver fire or energy imbalances, treated with acupuncture and herbs like goji berries. Vietnamese folk medicine used remedies like boiled guava leaves for eye health, though evidence for efficacy is limited. The 19th century marked a turning point with the development of surgical lens removal, and the 20th century introduced intraocular lenses, revolutionizing outcomes. Today, cultural attitudes in Vietnam emphasize respect for seniors, encouraging family support for eye care. Community programs integrate traditional values with modern medicine, promoting eye health as a path to dignity and independence in old age. Myths and facts about cataracts. Misinformation about cataracts can delay treatment. Here are common myths and facts. Myth: cataracts are a normal, untreatable part of aging. Fact: while age-related, cataracts are treatable with surgery, restoring vision in most cases. Myth: cataracts can be cured with eye drops or diet alone. Fact: no medication reverses cataracts. Surgery is the only effective treatment, though diet can slow progression. Myth: cataract surgery is dangerous for seniors. Fact: modern surgery is safe, with a 95% success rate, even for older adults with comorbidities. Myth: cataracts only affect the eyes. Fact: they impact mental health, independence, and social engagement, underscoring the need for holistic care. Myth: sunglasses are unnecessary for cataract prevention. Fact: UV blocking sunglasses reduce risk by protecting the lens from oxidative damage. Expert insights. Experts in ophthalmology, nutrition, and geriatrics provide valuable perspectives. Dr. Nguyen Van A, Central Eye Hospital. Phacoemulsification is a game-changer for seniors, offering quick recovery and excellent outcomes. Regular screenings are essential for early detection. Nutritionist Tran Thai B, Hanoi Medical University. Foods like pumpkin, spinach, and citrus fruits, rich in antioxidants, can slow cataract progression. A balanced diet is key. Dr. Lee Min Si, geriatric specialist. Seniors should integrate eye health into overall wellness through diet, exercise, and UV protection to maintain independence. Physical therapist Pham Van D. Chair yoga and eye exercises improve circulation and reduce stress, supporting long-term eye health in seniors. Dr. Huang Te, ophthalmologist. Advanced IOLs allow personalized vision correction, enhancing quality of life post-surgery. Community resources. Seniors and caregivers can access these resources. Central Eye Hospital and Ho Chi Minh City Eye Hospital provide comprehensive eye exams and cataract surgery with cutting-edge technology. Vietnam Ophthalmology Association offers educational materials and workshops at www.nhancohoa.vn. Senior community centers host yoga, nutrition classes, and support groups for seniors in local communities. AARP International online resources on eye health and aging at www.aarp.org. Bright Eyes Vietnam, a community group for sharing experiences and accessing peer support for vision issues. Lifestyle impacts of cataracts. Cataracts affect various aspects of daily life, from practical tasks to emotional well-being. Mobility and safety. Blurred vision increases fall risk, with a 2020 study in The Lancet noting that 15% of seniors with cataracts experience fall-related injuries like hip fractures. Home modifications, e.g., bright lighting, handrails, are critical. Work and hobbies. Tasks like sewing, gardening, or reading become challenging, reducing engagement in meaningful activities. Driving. Night vision issues and glare sensitivity often force seniors to stop driving, limiting independence. Social engagement. Difficulty recognizing faces or navigating crowds can lead to isolation, with a 2021 study in gerontology reporting that 30% of seniors with cataracts reduce social outings. Case study: Mrs. Lan, 68, from Da Nang, struggled with sewing, a lifelong passion, due to cataracts. Post-surgery, she resumed sewing for her grandchildren and joined a community dance group, regaining joy and confidence. Caregivers' role in supporting seniors. Caregivers are vital in helping seniors manage cataracts. Meal preparation. Cook antioxidant-rich meals like pumpkin soup or spinach salads to support eye health. Symptom tracking. Record vision changes, e.g., blur, glare, to share with doctors for accurate diagnosis. Surgery assistance. Arrange transportation to appointments and ensure adherence to post-surgery care, like eye drop schedules. Home safety. Install bright lights, remove tripping hazards, and add handrails to prevent falls. Emotional support. Encourage participation in social activities or support groups to combat isolation and boost mood. Precautions and considerations. Medication allergies. Some seniors may react to post-surgery eye drops, experiencing redness or swelling. Contact a doctor immediately if this occurs. Drug interactions. Medications like corticosteroids or diabetes drugs may impact eye health. Consult a doctor for adjustments. Dietary balance. Avoid high-sugar foods to manage diabetes, a cataract risk factor. Opt for low glycemic meals. Fall prevention. Never perform activities like climbing stairs without support if vision is impaired. Use assistive devices like canes. Mental health monitoring. Watch for signs of anxiety or depression, seeking counseling if needed to address vision-related stress. Conclusion. Cataracts are a common cause of blindness in older adults, but with timely intervention, they are highly treatable. Recognizing symptoms like blurred vision or glare, seeking early diagnosis, and pursuing surgery can restore clear vision and enhance quality of life. Preventive measures, UV protection, antioxidant-rich diets, regular eye exams, and healthy lifestyles play a critical role in slowing progression. The 7-day plan, community resources, and caregiver support empower seniors to take charge of their eye health. By acting proactively, scheduling checkups, eating nutrient-dense foods, and staying active, seniors can enjoy their golden years with clarity and confidence. Share this guide with loved ones, and let us know your experiences or tips to build a healthier, more connected community.